How's it going, guys? We have a medium difficulty question for gastro, for surgery, for TCK, for studying for step one. I'm going to tell you some high yield points you need to know. So, 58-year-old woman, she has severe abdominal pain, fever brought to a physician by her husband. CT of the abdomen is shown. Vitals are temperature 102 Fahrenheit, heart rate 76, respiratory rate 16, blood pressure 120/80. Bowel arrest is initiated, nasogastric tube is placed, IV saline administered, laboratory studies are performed to corroborate the diagnosis, which I find most likely or the most appropriate next best step management here. So this patient has acute pancreatitis, and we gave a classic triad of bowel rest, which is NPO, nothing by mouth, NG tube, and IV saline. This is an exceedingly high yield triad for USMLE, not just for pancreatitis, but for any number of miscellaneous GI conditions. Could be cholecystitis, choledocholithiasis. Okay, so they like this triad to the point where they can just tell you bowel rest and NG2, bowel rest initiated, NG2 is placed, next best sub management, fluids. Where fluids are given, NG2 is placed, what else should be done? Bowel rest. Okay, so you got to know this triad. And then laboratory studies, I was intentionally vague here, which just would be our amylase lipase are going to be elevated. So this is acute pancreatitis, okay? And then this image, which we have the black circle here, this is pancreatic pseudocyst. All right, so I jacked this image off of Wikipedia, in fact, and there is a very similar CT scan on one of the surgery forms for TCK. They give you a massive pseudocyst. A pseudocyst means you have pancreatic fluids, okay, so fluid collection due to enzymatic fat necrosis, but we don't actually have concrete walls to the fluid collection. It's just held together conveniently by pancreatic parenchyma. That's why we call it a pseudocyst. So let's just hop to the answer choices here. Next best step. Choice A, biopsy of lesion. Wrong fucking answer. Okay, I mean, I don't really know what to say. It's not a cancer. Okay, maybe some of you may have thought that. Pancreatic cancer in USMLE is not going to present with fever. Abdominal pain can be plus or minus. I've seen occasional questions where they can say abdominal pain, but it's not classically part of the presentation, okay? And then a key point is that your pancreatic enzymes will not be elevated with pancreatic cancer in USMLE. That's often erroneously assumed by students. So you need that they're positive, they're not. Okay, so amylase and lipase, if they give them, would not be elevated for pancreatic cancer. Wrong fucking answer. Choice B, ERCP, correct answer. Now, what we're going to do is we are going to drain the pseudocyst internally via ERCP. Now, if you think this question is weird or nebulous, you say, Mike, you could drain it via endoscopic ultrasound in theory. I don't know what to tell you. It's on the NBME exam. Okay, they literally give you a nearly identical question here. Give you this big fucking pseudocyst on nearly identical CT, and the answer is just ERCP, and you're going to drain it internally. Okay, that's what they want you to know. So let's just hop to the other answer choices. C, HIDA scan, wrong fucking answer. This is what we do to confirm diagnosis of cholecystitis if our ultrasound is negative or equivocal. So with our HIDA scan, we're going to have a radio dye that's taken up by the liver, secreted into bile, and if the gallbladder lights up, that means we do not have an obstruction of the gallbladder, and cholecystitis is negative as the diagnosis. If the gallbladder does not light up, it means we do have an obstruction, and cholecystitis is the diagnosis, because cholecystitis over 99% of the time is caused by an obstruction of the gallbladder. Wrong fucking answer. Choice D, MRCP, wrong fucking answer. So I've never seen this as a correct answer on any NBME assessments. It's always a wrong answer, always a distractor. This could visualize our common bile ducts, or bile duct / the common bile duct, but never seen it as correct in USMLE. Wrong fucking answer. Choice C, Whipple procedure, wrong fucking answer. So it's also known as pancreaticoduodenectomy. This is done namely for head of pancreas cancer. There are other indications, but head of pancreas cancer is classic on USMLE. So you're going to be removing the head of the pancreas, the first part of the duodenum, the common bile duct, and you're going to be removing the gallbladder because we've removed the common bile duct, so hence we remove the gallbladder. And sometimes part of the stomach can be removed, but newer versions of the procedure, they tend not to remove the stomach. Whipple procedure, I don't think I've ever seen as a correct answer in NBME. It's rare, in fact. It just tends to be a somewhat well-known eponymous procedure that you could be aware of. You could know what a Whipple procedure is, that it's done for head of pancreas cancer, but I've never seen it assessed in NBME exams. head of pancreas cancer, highest yield point you need to know is that apart from the pancreatic enzymes being normal, you're going to have impingement on the common bile duct causing jaundice, Courvoisier sign. So a painless palpable gallbladder, afebrile patient, jaundice, and then the next best step is just CT. Okay, so our short point of consolidation here is that acute pancreatitis can cause a pseudocyst, this fluid collection, and USMLE following the triad of NPO, which is bowel rest, NG tube, and fluids, that we're going to do internal drainage via ERCP. You know the deal. To make more content, if you like my stuff, subscribe my channel. Appreciate your time. That's it.